I'm going to send you live, so bear with me a second, Beatrice, and I will tell you when you're live. You're now live, Beatrice.
Good afternoon, everyone. Welcome. My name is Beatrice Miesta, a member of Birmingham City Council Citizen Involvement Team. I'm going to be your chairperson today, and my co-chair is Amanda Hine. Sorry. Let me introduce you today to our agenda. Who are people for public services, code of conduct, our team life work for how our team life work for you, how working together to keep vulnerable people safe in our city is going to be presented to you by our wonderful Sherry Dell, our independent chair and of Birmingham Safeguarding Board. This is some background. Some of you might recognize themselves in those pictures when we used to meet in the big room, sharing our meeting, met face to face. Today, and this is let me introduce you to the team who work tremendously hard to empower all of you here. This is the picture of our team. Today, we always have a code of conduct to respect. Respect exclusively. Respect each other. Treat each other as equals. Everyone needs to understand and speak. Let everyone speak in the clearly manner and the language, simple language, not jargon. Let me hand over to you to my co-chair, Amanda Hine. Amanda, over to you. Thank you.
Thank you so much, Beatrice. Welcome everyone to People for Public Services Monthly Forum. My name is Amanda Hine. I'm Citizen Involvement Officer for Birmingham City Council. Those of you who have joined us previously will know that we are using this forum as an alternative to meeting space in person, and that keeps us in a safe environment. It does bring new challenges, as we experienced last month. However, it does give us the opportunity to hear your comments and your voice on the topic that we've chosen, which this month will be safeguarding. So I'm just going to introduce you to the area on the side of your screen. Hopefully it's on the side of your screen where you will be able to comment and write in your comments and questions throughout the event. So I hope you will all be able to do that. And the presenters and Cherry will be able to pick up those questions throughout the event. We're not going to use Mentimeter. Some of you may have experienced before, because we actually couldn't get it to work. So there's one of the challenges that we've experienced this month. So it just be chat only. So thank you very much for joining us. I hope you enjoy the presentation, and I'm going to hand over to Cherry Dale.
Thank you, Amanda, and thank you everybody for inviting me along this afternoon. My name is Cherry, and as you've just heard, my job at the moment is to chair the Safeguarding Adults Board in Birmingham. So what we're doing over the last 2 months and the next 2 months to come, we're actually consulting everyone on our new strategy. And it's quite amazing to me, but Simon reminded me in a pre-meet that it's actually 2 years since I spoke to you last, doing exactly the same thing about the strategy then that is now nearly over, and time has just flown by. I really can't quite believe that. So I'm very grateful to be back again today to talk about something similar. So just to kick us off, if we just refocus our minds on what is safeguarding. So safeguarding really is about making sure that people can live in the city or anywhere in the country free from harm and abuse, and free from the fear of harm and abuse. And the way we do that is the board works in partnership with all organisations across the city. That could be very small one-person bands, community kitchens, it could be third sector or faith sector, right up to statutory sector by the City Council or fire or police services or the NHS, for example. We work with all of those partners to make sure that they're carrying out their safeguarding duties, and our job is to seek assurance that they're doing that. So if we can just move on. So you'll find within safeguarding that we cover a certain amounts of types of abuse, and they are as follows. So you may come across physical abuse, and that's an area that the board will be concerned with. Domestic abuse is another area of our concern. It may be sexual abuse or personal abuse. It could be psychological or emotional abuse, and some of you may have seen in the press that word coercion or coercive, which is basically when we talk people into doing something that isn't in their best interest, isn't looking after them, but is making them very poorly or unwell or unsafe. It could be financial abuse, so it could be somebody talking somebody or coercing or bullying or threatening somebody to spend their money in a way that they don't really want to. It could be modern day slavery. It could be discriminatory abuse against the person because of their religion, because of their heritage, because of the community that they're from. Or it could be organisational or institutional abuse. And you may have seen things in the press or on the TV around places like Winterbourne, where people go to stay when they have a disability or a learning disability, and there could be organisational or institutional abuse going on there. That's something that the board has to be involved in. It could be neglect or acts of omission, which basically that we are neglectful, services are neglectful in their duty to support people, or it could be self-neglect. So if a person isn't getting enough support, they start to neglect themselves. There we go, self-neglect. I preempted the last one. So those are the kind of areas, and there's a few other nuances between those areas as well that the board are interested in. So our job is not to deliver a service, but to seek assurance that all of those other services in the city are supporting people to be free from those kind of harms that you see there on your screen. Thank you. So I'm very keen today, as well as talking about the strategy, to understand what's your biggest worry about safeguarding. Now, safeguarding in our world, we look at people with care and support needs. Now, some services across the city use safeguarding to cover everybody, but for us, and we have a statutory duty under the Care Act of 2014 to focus on adults with care and support needs. So those are adults who will need some support from multi-agencies and who can't look after themselves either personally or safely, and that may be in harm's way if they don't get support. So that's what I mean by somebody with care and support needs. So I'm very keen to hear from you and use that chat function that Amanda mentioned. So what's your biggest worry about safeguarding people with care and support needs in the city? That's one of the questions I'd like you to think about.
Would you like to move on, Cherry, or do
Yes,
you want
yes.
to give it a moment?
Yeah, if anybody would like to put anything in the chat now, please feel free to do so, and Adi will let me know, and I'll answer your queries or come back to you on that, or we'll just keep going.
Brilliant, thank you, Cherry. I'll move on.
So this is our board website, and we're putting it up here when we're doing this consultation because I just want to encourage you all to have a look. Now, we're constantly updating this based on the feedback we get, such as from folks like you when I come out to these kind of meetings, because you tell us whether it's accessible, you tell us whether it's readable, you tell us whether it's useful, or if we're missing something on there. And that's really important to people like me and Carol, because the only way we know is if you give us that feedback. And we're doing our best to make sure that anybody can use it. So you'll find on here those buttons, you'll see 3 there on your screen. It'll explain a little bit more under that what is adult abuse, a little bit more than I've had time to talk to you about today. The middle button there on our website tells you how to report abuse, and you can do that in a number of ways, through the website, through a phone call, through a form. And also it'll tell you a little bit more on that far right, that kind of yellowy looking button. It'll tell you a bit more about what the board does and what my job is, what Carol's job is, and how we work to safeguard adults in Birmingham with care and support needs. Thank you, Simon. So at the moment, this is the draft copy of our strategic plan. I have to have it in place by September. And the last couple of months, we've been visiting lots of organisations and lots of meetings where people meet already. I don't believe in bringing people in to see me. I think I should be the one that does the legwork and comes out to meet you where you already meet. So what you'll see today is the shape it's starting to take. It's not in a tablet of stone, it's not finished, but we've met and heard with an awful lot of people so far. So we just wanted to draft something up so we get a feel for what it's starting to look like. So you'll see there, safeguarding is everybody's responsibility. And that's one of our big priorities. And you'll hear a little bit more of that in a moment. Thank you, Simon. So this is what we're calling our plan on a page. So we'll have the strategic plan, and when it's completed by September, we'll send it out and you can have access to that, or you can have access to it through the website and through the forum. But equally, we like to do a plan on a page for those people that don't like reading. If you're like me, I always go to the action plan. Sometimes all that narrative is too much and I like to go, right, what they're going to do about it. So here we go. These will come up one at a time. So you'll see that in that Care Act, we've been given 3 responsibilities, and they're a statutory legal responsibility. We have to publish a strategic plan. We have to publish our ambition. We have to publish an annual report. We're just writing that now, and it's usually just after the 12 months has ended. And we have to complete safeguarding adults reviews when an adult has been harmed, injured, or neglected, or unfortunately may die from a multiple agency involvement in their care. If there's only one organisation involved in their care, then that organisation has to do their own review. But if there's more than one, then the board will commission a safeguarding adults review to look at what happened, to find out the learning, put some recommendations together and ensure that the changes are made. Thanks, Simon. So you can see on here what the board role is. So the board's role there, I've already explained, is to make sure that safeguarding arrangements are in place as defined in that Care Act, to make sure that everybody's safeguarding is person-centred. And basically what we mean by that, it's wrapped around that person, that we don't make decisions that that person really doesn't want us to do. That we don't wrap somebody up in so much cotton wool and bubble wrap that we ruin their life. We strangle them with all of our worry about keeping them safe, but we support them to be able to make their decisions and to understand the risk. That we work collaboratively across wider partnerships as much as possible. That we make sure that agencies and individuals are acted with and for where abuse and neglect has occurred very, very quickly. We seek that assurance and we concern ourselves with a whole range of issues where people with care and support needs are impacted. And one of the big areas for us is prevention and early intervention. I'm too long in the tooth and long past only being involved in something when something terrible has already happened. So the last 4 or 5 years, we've really focused on working on prevention and early intervention in the world of safeguarding. Thank you. So within our structure, there's me as the independent chair. So I'm hosted by the City Council, but I'm completely independent, which means that I still hold the City Council to account, just like all of the other agencies. We have a strategic delivery group that makes sure we're doing our business, and all of our subgroups do our business. And you can see there we have a few other subgroups, a learning and development subgroup, safeguard and adult review subgroup, and a quality and performance subgroup. Thank you. So this bottom row here are the shape that our 4 strategic priorities are taking. And as I've said, they're not in a tablet of stone. This is just looking likely at the moment from the feedback we've got so far. There's plenty of wriggle room to move them. So priority 1 is looking likely to focus on communication and involvement, where we keep making safeguarding everybody's business. So it's not just a specialism, it's all of our business, whether you're working on reception or whether you're the chief exec. Improve the awareness of safeguarding across all citizens, all communities and all partner organisations. Then next we've got strategic priority 2, where we're aiming really around prevention and early intervention. This has come loud and clear that everybody we've spoken to so far wants us to keep this as a key priority, where we develop strategies with our partners and all the agencies in the city to reduce the risk of abuse, to increase early intervention. And then priority 3 is to keep that focus on making safeguarding personal. Keep working and keep seeking assurance from those agencies they're keeping the person at the centre and supporting people to make their own decisions to stop that harm and abuse. And then finally, priority 4 is looking likely to be around learning through development and assurance. So my strapline is knowledge is responsibility. So if we know something, if we've learned something, if something terrible has happened and we've learned what went wrong, we have a duty to share that and a duty to make sure the recommendations are carried out, the impact is felt, things change for the better because of what we've learned. So people are asking us to keep doing that because they feel the feedback has been that the board do that really well, and that citizens have felt changes wherever they are, and carers have felt change, because I've also met with carers groups because of what we've done, because we've kept an impact on that. So the next slide you'll see, after this question, the second question I want you to think about, I'm going to go to Adib in a bit, but the second question I want you to think about then is, what do you think about those 4 priorities? So yes. Adib, thank you.
Yes, thanks Cherry. Yes, I'm Adib, I work for the Citizen Involvement Team. There's a few questions in the question box, or actually comments and questions, and the first question that you asked was what was people's biggest worry with safeguarding, and someone commented saying other people in the community. So that's a comment that we've had back. We've also had Faye make a comment or suggestion or sharing her views about her 22-year-old with learning difficulties. She's unable to secure help for her daughter. For example, she says an actual correct diagnosis and advice on how to protect her. What do you want to respond to that, Cherry, at all for that?
So it's help or health. Sorry, I couldn't quite hear you.
Help
altogether.
Yeah.
I guess the only route to secure any help is either through the health route or through Birmingham City Council route. So that would be a referral into them, and my best advice would be to go through the GP to get some support to put in any kind of referral.
Yes, or through adult social care possibly as well. Yeah, and we'll post the link to the webpage for that as well.
And the GP will also support a referral into adult social care.
That's correct, Cherry. Right. There's another query from Alan, and he's asking if there's a published guide for carers about safeguarding.
Forward carers are really good at safeguarding guidance and advice. So that would be my first encouragement, is to go and have a look at the Forward Carers website. And we're starting to work in partnership with them at the moment, and that's one of the things that I was asked, is whether we had anything on our board website just for carers. So that's going to be on our priority list in terms of accessible information.
Okay. Yes, and someone anonymously responded saying that they're great. I think that's all the questions I can see for now.
So far.
Yeah.
So, Cherry, just to let you know, I just moved back slightly so people can just soak up, for want of a better word, your 4 priorities. Sorry, and that gives them chance to be able to come back. And then what I'll do is, if we just pause for a moment, and then we can reiterate this question for people. You know, what do you think? It's great that somebody's put they like them, but keep thinking about that. So we'll just pause for 1 minute, if that's okay, or 30 seconds. You can catch your breath. Is there another comment, Adib?
Yes. Okay, we've got an anonymous comment. My fears are the consistent failures by GPs and other bodies which are perceived to be of assistance. So that's a comment by someone anonymous. And there's a new one that's just come in. What regulation and inspection is in place for private providers who offer supported housing? Oh, someone's moved it. All right. Supported housing for vulnerable people. That's another comment. Don't know if you want to respond.
Yeah, if you're talking about the exempt sector, sadly, there's no formal regulation, but Birmingham has been working really hard since 2018 to bring in quality standards, and we've done this through co-production. So there's been a working group, because it was flagged by the Safeguarding Adults Ward by us in 2018 that this was a real concern in the city. So if that's the sector you're talking about, that we now have quality standards that we're asking them to sign up voluntarily, because the government at the moment, although we're lobbying hard alongside other parts of the country, the government at the moment have not put any regulation into that sector. So at the minute we have quality standards, we have the board is asking for assurance from all referring agencies they only refer to the sector who have signed up to the quality standards. That's one thing we can do. The other thing we have is a quality standard for people who use those types of accommodation to say, this is the service you should be getting. If you're not getting it, here's where to go to get help. So that's the second part of that. And the third part, that Birmingham City Council, in particular through Councillor Sharon Thompson, is lobbying the government really hard to get some regulation into that sector.
Okay, just repeating the one that, I don't know if you picked it up, my fears are the consistent failures by GPs and other bodies which are perceived to be of assistance. I'm not sure if did you pick that one up as well on that?
No, I understood it to be a comment. It's not.
Okay.
It's not really within my remit. I don't have any regulatory powers other than working with the CCG to make sure their safeguarding is in place. But I accept if that's your experience.
Okay, and okay, there's another comment for someone anonymous. Are the ambitions for all areas, e.g. service providers, people, individuals? So that's a question about, yes, so it's covering all areas. Okay. Right, a comment from Elizabeth. Yes.
I was going to say, after Elizabeth's question, I'll bring Cherry back in, so that because some of this might provoke more questions in the next bit, but I'm going to give Cherry plenty of time to run through this as well. So after Elizabeth's question, if we're okay, guys, we'll move on.
Sure.
Okay.
Not forgetting the questions, but we've got plenty of time to pick them up at the end.
Okay.
Right, and Elizabeth is saying that she's concerned, very greatly concerned about the exempt sector. Vulnerable people will be too scared to complain about the lack of support. That's more of a comment and a concern.
Yeah, but an absolute on the money one. Of course, Elizabeth, you're absolutely right. So that's the work that we're doing and organisations are doing with support services, so that those people get much better wraparound support. And the awareness around the exempt sector and the partnership working, particularly between housing, social care, police, fire and health, has been tremendous. And we really are beginning to start to make waves. There's a long way to go. I think the biggest shift we'll get if we can get the government to put in some regulation, because that will be the biggest power that we have. But I think Birmingham is doing what it can at the moment to make sure that we have quality standards, that we only refer to those places that have met those voluntary quality standards, and that we make people aware of what they should be getting and how to get support if they're not getting or if they're being treated badly, and we wrap round services of support around those people.
Brilliant, thank you, Cherry. If you want to pick up the second part of your
Oh,
strategic plan. It's the doing part, please.
Yeah, so you're absolutely right, Simon. This is the doing bit. So these 4 columns sit under those 4 priorities, and these boxes here are a selection of the things that people have actually said to us they want to see. And these are the ones that the majority of people have said they want to see. So we'll still do some others, but these have got the highest number of ticks, if you like, of yeses from folk. So everybody, without exception, have said they want us to keep making sure that website is better, is more refined, has even better accessibility. And this last couple of months we've just started. I think you may have had our first draft strategy in easy read form. That's the very first one that we've managed to do in complete easy read form. So we're starting to do that. We've been challenged again around other areas like Audible, so we're looking into that. Around grayscaling, we're looking into that. So we keep listening, and that's why it's so important that, and I'm so grateful to be invited to your meetings, because I need to know this stuff so we can keep improving it. So that's one of the areas. Again, similar kind of vein, keep making sure those leaflets and publications are accessible and equally involve citizens. So we're really into co-production this last couple of years following the last strategy. If you remember, that was one of our ambitions at the last strategy, and we've made sure that we're doing that. The carers in particular have asked us to raise awareness of safeguarding in carers, and particularly around carer stress, carers abuse, carers assessments, to make sure that they're supported. Thank you. We continue to engage and involve citizens and partners in every aspect of our work, and although we're doing that, people didn't want to lose it, so they want to see it in the strategy again, so I'm going to make sure it's in there. And then that final one under priority 1 is continue to seek assurance that vulnerable young adults who are transitioning from children's services to adult services are supported. Now, since the last time we met, that was our priority, and we've now got a transitions team in Birmingham that we didn't have before, and the board has been part of that development, and we still work very closely in seeking assurance with them. And when I met with the carers, they gave us some more feedback, which I've now passed on to them again. Thank you. So the next column is under that priority 2. So they want us to check on information sharing. Now, we were just about to review our information sharing guidance anyway, so this is kind of preempted something that was on our agenda. A lot of feedback I've had that people have to keep retelling their story even now, even though a lot of work has been done. So we'll focus on that in our assurance system. And the next one is develop and implement the new safe neglect protocol. So we've had a protocol and it just needs refreshing and updating, and we're doing that now. And there it is, keep on our priority, not take our foot off the gas around exempt accommodation. And we've been doing this in 2018, but we're certainly not going to take the foot off the gas anytime soon. Continue to share that information that prevents abuse and neglect due to loneliness and isolation. Now, last month we held a Safeguarding Adults partnership event with over 80 organisations that joined us virtually, and we talked about the impact of loneliness and isolation, which of course is enormous and has been exacerbated even more during the COVID and pandemic period. So we'll keep that in there and we'll keep on that. And finally, we'd already started some assurance work, and if you remember, I talked to you about this. I think it actually might have come from this group 2 years ago, so we put it in our strategy because you told us it was a big problem. And we've started the work around this about a year ago, and they came to the board only not last week, week before, to give us some assurance around progress they've made. But talking to people so far during this consultation period, and in particular carers, there are still some really big issues. So we've put it back into this new strategy. So under priority 3, you'll see here that they want us to continue on the assurance activity, but in actual fact, it's in the Care Act and that's a statutory duty. So we do have to do that, and we will. We need to keep a focus on missing adults. Now, the police have had a new guidance framework that came out about 12 months ago, and we've been seeking assurance on it. but we need to make sure that actually works very closely with all of the partner organisations, and we will do that. And then the police have also had what's called a poor relations report, which was all around abuse and crime against older adults. So there's some recommendations within that, and the board is seeking assurance that West Midlands Police adopt the recommendations. And we collect an awful lot of data, as you might imagine. So we're updating what we're calling a safeguarding dashboard, which is basically on a page how we see the data and how we look at the trends, how we analyse that data that gives us some goals and targets to talk and put some assurance into our organisations. And then finally, under that priority 3, one of the key actions is around making safeguarding personal. So we were rightfully challenged. How do you know? People tell us regularly it's embedded, that it's working on the front line, that people are at the centre of everything, all their practices in all of the organisations. And we were challenged to say, prove it. I like that kind of challenge. That suits me. That's my kind of language. So what we're going to do is going to do an audit of the activity that organisations have around making safeguarding personal. And we've just completed a challenge event on Monday and Tuesday of last week, where I met every organisation on our board with our business manager and with the chief exec of Healthwatch, and we interviewed them around how they make sure safeguarding personal is embedded. So that's part of that work. And then our priority 4, so these are the areas that are coming up as high priority actions under that priority 4. Seek assurance around health and social care that there is an integrated system, and it worked really well during the pandemic. All the castle walls came down, all the portcullis and the trellis came down, and everybody worked very, very well together. So we're seeking assurance that we don't lose that. And LEADER, which is learning from deaths of adults with learning disabilities. We work really closely with this team anyway, and we champion the work and their recommendations and their action plans, but we'll increase that work during the next two years. And the board assurance framework, this is virtually there. This is our way, and in some of that narrative and the conversation I was talking about earlier, we're already part way to making sure this is updated. And again, learning from Safeguarding Adults Review, that's a statutory function, and we have to make sure that organisations follow through on those recommendations and complete their action plans and are able to monitor the impact of those changes. And the final one in there is to make sure they've got a yearly learning and development plan. We've just published, and if you want to go to our website at some point today or in the future, you'll see our competency framework. And we've just published an updated competency framework. So organisations, however big or small, can check them and check their staff against them and make sure they're competent in safeguarding. And that learning and development plan will pick up all of the conversation that I've had with people like yourselves during this consultation period, and we'll make those changes, we'll put them into that development plan. So those are the high level actions that we've got so far that are coming out of the conversations that we've been having over the last couple of months. So just to let you have a think about those actions, what I'm really keen to understand is, do they sound right to you? Is there something that jumps out you think actually you've missed something here? What do you think?
So just on that, Cherry, I'm going to bring the other question up and I'll pop it in the chat again, because, you know, so again, just to ask people, what do you think of the plan? Yeah. And then, are we missing anything? So I'll pop that into the chat but I'll leave this up for a few moments. You can get a drink of water if you wish, and if people have got any comments or anything that's been at deep, bring them in, if that's all right.
That's fine, thank you, that's good.
I was just going to say that there were a few comments following the previous question. What do you think about the 4 priorities? I'm not sure if they're related. Manminda said there is daily mobile scam calls made to everyone. This is a bigger problem for adult people. So that's a comment, and that's their view. and people were asking for links, and Carol's kindly sent out some links to the safeguarding website for Birmingham. And someone asking for sign up. To ensure safeguarding, can you implement regular audits on providers? And Carol's responded to that. As a board, we're not an operational team. The contract providers are monitored by BCC commissioners and safeguarding built into the specifications, or have them built into the specifications. We as a board then receive assurance on quality and the provision of safe care delivered. So I don't know if you want to add to that, or do you want me to move?
Yeah, I mean, Carol is absolutely right, and not just BCC. So we also seek assurance from anybody that commissions. So that could be the clinical commissioning group, it could be the trusts, so the hospitals also commission some third sector organisations, for example, and we seek assurance. And part of that challenge event last week was how are they putting safeguarding assurance in their commissioning, in their procurement work. So that part is our job as a board. But Carol's absolutely right. When we don't deliver, we're not operational. So we can't do any service provision as such. And regarding the financial scams, yes, you and me both. I think every individual in the country will be having those scams, unfortunately. But for some, they're very real, aren't they? Because they might be the only contact they have. And if it's a friendly voice, then it's very, very difficult. And my own father had one this week, asking him questions, saying that his computer isn't working. He needs to pay for some analysis on the computer. He needs this, and it was a very friendly man, talking to him, asking how he was, how's his wife, as though he knew him. The actual fact is my dad does not own a computer at all. But he was saying to me on the phone, you can see how people are drawn in if you're isolated, and we picked up this on our loneliness event. If you're isolated and lonely and somebody's very friendly, very chatty, I'm here to help you, you can see how people fall into that trap. So the board has been supporting the work of trading standards, and we've been sending out lots of messages. And through our work on loneliness and isolation, we've equally been asking all of our organisations to increase the work they do in making contact with people and making sure people are aware that of these scams and what kind of words they use, how friendly they are, how they try to trap you in that I'll look after you kind of mentality. So we do need, I think, as all organisations coming together as a partnership, we need to do a lot of work on that.
Okay. Thank you, Cherry. Okay, and we've had a comment from a carer, and it's about carers who themselves were involved in a safeguarding issue to do with a care home who failed to administer daily medication on 2 occasions. Although the carers were present when the social worker investigated, after the meeting they heard nothing back. Should carers get feedback on safeguarding related issues?
I would say if you were involved in the investigation, then it's respectful for you to have got some feedback, whoever you were, and whatever background you've got. Out of all due respect and due process, everybody should have got feedback. So I would say that was poor practice. In terms of general carers and support, this came up when we did our carers consultation on this strategy, and they felt that they didn't get included as much as they would like. And I do understand that we can say we're working with adults, but when the adult is greatly supported by the carer, they at least need to be treated with respect in terms of engagement. So it's something that I fed back to the Director of Adult Social Services only last week from that carers group, and I'll keep pushing that button, because I absolutely think we need to rethink that position.
And I think Carol posted a link to the Herbert Protocol. I think that's related to it.
Yes, it's related. Yes, please have a look at that. Yeah.
Okay, fantastic. Okay, right. Are we missing anything on the plan? I really like the plan. Okay, someone anonymous says I really like the plan with dolls being separate. That's a comment.
So, So DOLS is managed by Birmingham City Council.
That's an abbreviation. Maybe not everybody understands that, so maybe we should. Yeah, sorry. Do you want to? Sorry, Terry.
So that, can you read the whole thing again then? Thanks.
It says, "I really like the plan. Will DOLS be separate?"
Okay. Okay. Yeah. So DOLS, we cover DOLS in terms of seeking assurance that DOLS are being carried out. So Birmingham City Council have a safeguarding team full of safeguarding social workers, and they cover DOLS, and it's their responsibility to do that. It's our job to seek assurance that that's being dealt with and that's being carried out in a timely fashion. So they have to come to the board to give us assurance and to give us an update.
Thank you. Okay. Another question from Elizabeth. For example, the deprivation of liberty.
Safeguards.
Safeguards. Yeah.
It's the new version of DOLS coming out. Well, supposedly next year. Keeps being delayed. Yeah.
Right. Okay. Sorry, I'm just looking at things that are popping up on my screen. Elizabeth asks a question for exempt accommodation providers. Can you make signing up to quality standards a condition for getting a contract? That's a suggestion.
Well, the biggest difficulty we have is most of them aren't commissioned. The majority of exempt accommodation are not commissioned. They are private sector set up in the city, because basically we are quite a magnet for this type of accommodation because of the amount of Victorian buildings we've got. They're wonderful opportunities to be divided up into lots and lots of multi-use accommodation, but they're not commissioned. So that's the biggest problem we have. That's why we have to go with voluntary quality standards, because some are very, very good and want to be seen separate to the ones that are very poor. So that's why we've got these quality standards that are voluntary at the moment. And on the other hand, we're lobbying the government to bring in that regulatory body around everybody on exempt.
Okay, Jerry, we have a question from someone anonymous. With the greatest respect, you said that you wanted to focus on early intervention. How do these actions link with this?
Yeah, good challenge. Thank you. So the actions, I guess, for me around early intervention would be making sure that everybody understands what they should be expecting and how to get support when they're not getting it. To make sure that carers are receiving their carers assessment, they're receiving support and information, that we engage with people regularly, such as yourselves. We're working with that transitions team around improving early intervention much further upstream, when just before people are transitioning in. At the moment isn't good enough, so it needs to be much earlier. So that's another early intervention. The exempt accommodation, the voluntary quality standards, early intervention before things go wrong. That's sharing information and seeking assurance that people are picking up our citizens who are lonely and isolated. That's another early intervention there, and prevention. Direct payments, we're working really hard on that and making sure we've got early intervention and not waiting until it all goes wrong there. Making sure that health and social care is sharing information, and that we're not costing away information that would save somebody's life or stop them from reaching harm. So I would say all of that, from my point of view, having been a previous provider and a commissioner in the city, would be an early intervention position.
Okay, thank you, Cherry. And we've had Carol and Amanda comment about the neighbourhood network schemes,
yes,
sharing information with the audience about that.
Yes.
And Amanda's suggested that if anybody's interested in the neighbourhood network schemes reference group meeting, please let us know. There was a couple of points made by one by Simon. His mother has these and it causes her so much stress. Amanda, her father-in-law, and her dad, it's a problem. Yeah, the stress. Yeah, it causes them a lot of stress. Yeah.
Just to clarify, we meant around the scam calling, Cherry. So
okay.
yeah, it now makes sense if read not in the right order. So yes, I get them all the while as well.
Yes,
so.
And they are incredibly stressful, aren't they?
But I think they're also very stressful for the person who is, I'm not a carer for my mum, but she will ring me up and say, is this real? What do I do about it? It causes massive confusion. So it's very stressful for everybody concerned. And we know they're on the increase. So it's just being very, very aware. We have something in the authority that we can post out around recognising scams, etc. So we'll share that with everybody when we email out everything later.
That would be very helpful. And the war on scams, I think the only thing we can do at the moment is to make sure that everybody is aware of what a scam looks like. And because they keep, these organised crime groups keep changing the way they do the scams, we need to keep changing the information. So as soon as something changes for them, we need to change the information we're sending out. And unfortunately, my colleagues in West Midlands Police often say to me that the scammers are so well organised and that their technology ability is so far ahead of ours, it's very difficult to keep up with them. So we've got to be aware ourselves, just know when to put the phone down.
Yeah. So I'm just moved on the presentation to the kind of the conclusion part for you, Cherry, if there's anything you want to kind of bring up, any other questions or comments for people, anything that you've kind of got today. I hand again to you.
Thank you. So this strategy, as I've mentioned, we've been working for the last couple of months, going to lots of different groups and lots of different sectors and asking the same questions. We've got a few more to go, and in particular, we're in another couple of weeks, we're seeing the multi-faith sector. We're going over to them, for example, and we've got another few groups in between. I'm seeing all the primary care GP groups. I'm seeing ambulance sector, but we've met, and they're still to come. So you've got time, is what I'm saying. If you go away and have a look at this strategy and look at that planner page, look at some of the actions and the priorities, and talk to people in the other groups that you go to. That's what I would really ask of you, if you don't mind me giving you another ask. And if you've got anything at all, could you please come back, and Carol will be able to put it in the chat, our board email address. But please let us know, because the only way we're going to get this right is if you tell us that it's right or wrong. And I really need to hear that. And the last time I came 2 years ago was brilliant, because it really helped to shape the strategy, and we really changed some of the things that you told us about. But I'm no longer on frontline service. I've worked in Birmingham since 1985, and I started off working with adults with learning disability and physical disabilities, providing services, and worked in the council for 19 years, and then went into commissioning in the health sector, and then on into primary care with GPs, and then the last 5 years been working for myself. So 5 years I've been outside of frontline services, and I rely on your ears, on your nose for what's wrong, on your eyes and your experiences. I absolutely rely on them. So please go away, have conversations with other people and come back to us, because I think together that's the way we'll make some changes. Thank you, Simon.
No, thank you. I don't know if anybody else has got any last minute comments, Adib, that they put in the chat, or if they wish to post them. We've got a couple more minutes before we hand back to Beatrice in a moment.
That's all the comments. Carol shared information about the trading standards website that people might find useful if with callers, ambiguous callers. But there's no other. Oh, there's a new question. Hang on. How can I access this presentation? Yes, that's come up before. We've posted the link to details of all our presentations to our website. We post them there. All presentations that we have will be posted on our website, and I'll post that again. This is okay. It's moved. This is billed as a live event, but the subtitles known in advance what is going on, what is going to be said. Is this a recorded event? Yes, it is a recorded event, and there will be subtitles for that. That was from Alan, and that's come up twice. Okay, I think they're questions aimed at us more than Cherry, I think.
it's just for you to wrap up, Cherry, really.
Okay, so thank you again for your time. I'm really sorry that we can't be together in person. I much prefer it if I could see you and talk to you and have that face-to-face conversation. But again, I'm very grateful that you always invite me back. It's a perfect opportunity for me to get to hear your thoughts and your views. So thank you. And we'll keep working on the Safeguarding Adults Board to do our best for the most vulnerable people in the city.
Thank you, Cherry. It's always a pleasure to have you here. And if Dee, would you mind putting our contact details into the chat as well? Just in case that's easier for people, and we will always pass everything on to Cherry and to Carol and the team anyway. So
yes, of course, yes, definitely.
Thank you.
right, I'm now going to bring back so it's over to you now, Beatrice. Beatrice, you're back live now. We can hear you.
Hello, everyone again. Can you hear me? Oh, hello. Thank you very much, Cheryl. Everyone who worked very hard to make this afternoon happen, this section happen. It's always a pleasure to have Cheryl with us. Safeguarding is very important for everyone's life. Children, citizen, community group, like Cheryl was saying, and we are very grateful to have you with us today. Thank you for your time and your commitment today afternoon. Let me introduce you for the date for our next meeting. We're going to be on the 14th of September from 2 to 3. Please, if you have more questions and you need more information, please do get back in touch with us via our email address, getinvolved@birmingham.gov.uk. I am also a member of a shared organization called Inclusive Life Project. Anything to do with you can get in touch, or citizen involvement team, please. We are here for you. Let's work together to carry on embedding, make people safe in our lovely city of Birmingham. We love you so much. Thank you very much for your time again.
Thank you, Beatrice.